So I'll be talking about the drug, the Relugolix combination therapy, its role in heavy menstrual bleed associated with uterine fibroids. It's a fixed dose combination containing Relugolix 40 milligram, estradiol 1 milligram, and norethindrone acetate 0.5 milligrams. It's been there in the global market since 2021, but has come to our country recently, this very year. So what is this molecule? Relugolix, it is a oral GnRH receptor antagonist. It competitively binds to the pituitary GnRH receptors and preventing the binding of the endogenous GnRH, so reducing the release of LH and FSH, which in turn decreases the serum concentrations of estrogen and progesterone. And this is the very basis of the treatment of a fibroid. Estradiol, we know, this is added because it is an exogenous estrogen. This is to pass up the pseudomenopause state and maintain the therapeutic levels of system E2. Like Dr. Seema just mentioned, that a critical level of estrogen has to be maintained to deny the menopausal status, but have a positive effect on the reduction of the fibroid and the mean blood volume loss. Progesterone is added. It is second generation progestin, norethindrone acetate, and the reason for adding it is to inhibit the endometrial hyperplasia due to unopposed estrogen. So the rationale of this therapy is, this combination is to mitigate the anticipated hypoestrogenic effects with Relugolix monotherapy. Monotherapy has just the drug, but the combination has estrogen and progesterone. So this is to negate the bone loss, resorption, and the vasomotor symptoms. So I'm borrowing a slide from her presentation. Ideal solution is one which will suppress estrogens enough to treat the symptoms, while at the same time maintain sufficient levels to prevent hypoestrogenic effects. So again, the level is maintained between 32 to 44 picograms. Like she just mentioned, this is to prevent the occurrence of postmenopausal symptoms. At the same time, reduce the menstrual blood loss, improve the anemia, and also decrease the pain scores. It is given once orally with or without food, started as early as possible after the onset of menses. And the recommended total duration so far is 24 months, that is around 2 years. So what is the global data? There have been numerous studies of these. Liberty 1 and Liberty 2 are the most prominent. This duration of study was 24 weeks. There were 2 primary endpoints and 7 secondary endpoints. So this is a 2-replicate phase 3 double-blind randomized placebo-controlled studies. Oof. What is the meaning of all this? So 2-replicate means 2 clinical trials having the same dose, the patient criteria, and the endpoints. And phase 3 means hundreds and thousands of patients were included. Double-blind is when neither the researcher nor the participants know what is happening. Randomized is that without any bias, some are given placebo and some are given the actual drug. So making the study more robust. What was the criteria of including participants in this study? Age, 18 to 50, and ultrasound confirmed uterine fibroids. At least one subserosal or intramural or an intracavitary submucosal fibroid, which is less than 50%, as Dr. Seema shown in the FIGO classification, with a diameter of more than 2 centimeters. Or there are small multiple fibroids, making the total uterine volume to up to 130 centimeters. The normal is up to, cutoff is up to 120. And third, must have complaint of heavy menstrual bleeding. So there was, in both those studies, Liberty 1 and Liberty 2, there were 3 arms. One set of patients were given just the placebo. The second was given the combination therapy. And the third was given a delayed therapy, whereby in the first 12 weeks, they were given only Relugolix, and the subsequent 12 weeks, they were given the combination therapy. And what were the endpoints? The primary endpoints were 2. The menstrual blood loss volume should be less than 80 ml. Anything more than 80 is considered menorrhagia. And at least 50% reduction in the mean blood loss volume from the baseline. There were 7 secondary endpoints: occurrence of amenorrhea, reduction in volume of mean blood loss, reduction in the distress from bleeding and pelvic discomfort, improvement in anemia, reduction in pain, decrease in the size of the fibroid as well as the uterine volume. While these studies were going on, they of course maintained the safety profile, keeping a check on the vital signs, the physical examination. They were assessed for any adverse events, clinical lab tests were done, ECGs and bone mineral density was tested, and also any endometrial hyperplasia. So in this graph we see that Liberty 1 trial, the placebo arm shows 19. This was to find out the composite primary endpoint, that was reduction in the mean blood volume loss, less than 80 and at least 50% from the baseline. So what do we see over here? In the placebo group, only 19 to 50% responded, whereas in the patients who were taking the combination therapy and those on delayed, there was an improvement of 80 to 73% in reduction of the mean blood loss. Coming to the secondary endpoints, reduction in blood loss from the baseline occurred as early as 4 weeks of therapy, and the maximum effect was achieved by 8 weeks and was sustained throughout the 24 weeks of the study. Coming to the pain associated with uterine fibroids, it was found again, you again look over here, the black graph is for the placebo and the orange bar is for the ones who were on the combination therapy. There was attainment of at least 48 to 47% patients said there was a reduction in the pain score. These are the very secondary endpoints, amenorrhea and pelvic discomfort and improvement in anemia and the quality of life and reduction on the uterine fibroid volume and the uterine volume. So except for the uterine fibroid volume, where the comparison was similar to the placebo group, almost all of them have had an improvement, those who were in the placebo. These were the two studies, Liberty 1 and Liberty 2, which were carried for a period of 24 weeks. Another 28 weeks were added to all of these participants who completed the Liberty 1 and 2 studies. So then these very patients were continued for another 28 weeks, making it a 52-week study. Now in the first study, Liberty 1 and Liberty 2 trials, there were 3 arms, one on placebo, one on the combination therapy, and the third was when it was a delayed, like initially they were given just the Relugolix, and then after 12 weeks they were given a combination therapy. But in Liberty trial 3, all of them were switched over to Relugolix CT. This was a study for 52 weeks, and as you can see that responders at week 52, all of these patients who were switched from placebo to the drug therapy, there was an improvement by 75 to almost 87% in the heavy menstrual bleeding complaint. The same set of patients, once they completed the third trial, were taken up for the long-term treatment, where they were now again from 3 arms to 1 arm, and then from 1 arm to 2 arms. One randomized distribution, 1 arm was kept on placebo, and the second arm was continued with the drug therapy. Again, the primary endpoints of maintaining the mean blood loss. Now, since they were already on the drug, there was an improvement in the mean blood loss volume. So the idea was to assess whether this continues even after week 52. And those who were already on the drug and switched over to placebo, what was the effect? How long did it last? And how quickly did they deteriorate? So please just focus on the lateral half of the slide. The Liberty randomized withdrawal. Here you can see there is a placebo arm and there is a drug arm. What was the result? It was found that after week 76, so this study had already been carried out till 52 weeks. So that means another 14 weeks, 24 weeks. After that, it was found the group which was taking placebo, immediately the response was negated, and 11.4% patients were left who still had a mean blood loss volume of less than 80. Whereas in those where the drug was continued, even till week 104, that is approximately 2 years, the mean blood loss volume was up to 70%. Now these patients who were on placebo and restarted having heavy blood loss, they were given a rescue treatment, and it was found that there was an improvement by 97%. This is the same given in a graphic form, where the reduction in the mean blood loss volume from 52 to 104 weeks. In the placebo, it was immediately within 6 weeks of stopping the drug, there was increase in the blood loss volume. So when they were rescued by restarting the drug, it attained the same result as those who were already on the drug therapy. A percentage of patients who achieved amenorrhea, it was found that majority of patients who continued taking Relugolix CT, they maintained amenorrhea even till the period of 104 weeks. Coming to the relief of pain, same it was the same incidence. More participants in the drug therapy had pain reduction to minimal uterine associated pain compared to the placebo group. The volume of the fibroid and the volume of the uterus remained stable in patient who received the drug from week 52 to week 104. That comes to almost 2 years of drug therapy. The positive effect continued. Improvement in the uterine fibroid associated quality of life, that is the pain, the discomfort, everything remained the same in the patients who were on the drugs. Coming to anemia, we know all that one of the major causes of anemia in the productive age or premenopausal age group is the presence of fibroid. And it was found that there was improvement of almost 28.4% in the women who had anemia, but once they started taking the drug, obviously there is amenorrhea, so there is improvement in the hemoglobin levels. So when I mentioned about this Liberty 4 trial study, where the patients were switched over from relugolix CT to half of them were randomized to placebo, and the rest continued taking the drug, it was found that even after 104 weeks, that is after 2 years of the drug therapy, the attainment of the primary endpoint was the same. Less than 80 ml of blood loss was the primary endpoint, which was about 78%, and 69% of women maintained. This is once they stopped at 104 weeks. So this trial study was for 2 years. After stopping for 2 years, then they continued these patients who were on the drug. Once that was stopped after 2 years, it was found that even after 4 to 6 to 8 to up to 6 months of trial, the effect continued. So the withdrawal symptoms were less. This is the same thing, the time to relapse. Time to menstrual blood loss volume more than 80 ml. And it was found that the study was continued for another 1 year. So from 0 to 52, it was found that in approximately 45% of the patient, the beneficial effects of the drug continued. While the studies were carried out, there was also keeping a watch on the adverse events, the occurrence of vasomotor symptoms, abnormal uterine bleeding, alopecia, decreased libido. And it was found that with the combination therapy and with the placebo, the incidence was comparatively less. At week 24, no cases of endometrial hyperplasia or endometrial cancer occurred in the group which was on relugolix. And the bone mineral density was preserved with the combination therapy. Now this is as far as the global data is concerned vis-a-vis in fibroids. Coming to the other conditions, medical conditions like adenomyosis, it was found that women who had fibroid with adenomyosis, and this was a subgroup trial. So first Liberty 1 and 2 was focused on patients with fibroids. The one who had fibroid with adenomyosis, this was a subgroup trial. It was found that 83.8 patients achieved reduction in HMB in relugolix combination therapy. When the study was carried out for 24 weeks compared to placebo, it was just around 27%. Spirit 1 and 2 and extension studies, those who had endometriosis, and it was continued for a period of 80 weeks. Again, the end results were better when compared to the placebo group. And coming to reduction of dysmenorrhea or non-menstrual pain, again those patients who were on the combination therapy had a better score. Now this is all about the global data. Have studies been carried out in our country? Yes, there is Indian data for this combination therapy in leiomyoma. And this was a trial wherein 338 patients were taken. This was phase 3. The period of study was 24 weeks. The objective of the study was to assess the efficacy and safety of the fixed dose combination oral tablets in comparison to leuprolide, that is a GnRH agonist given in intramuscular form in patients with heavy menstrual bleeding associated with uterine fibroids. So we had two groups, one on the GnRH agonist and the other on the GnRH antagonist. The primary endpoint was to see in last 28 days the reduction of the pictorial, this is amount of bleeding. This is the chart which they have to see how much of blood loss has happened. And what was the result? Patient who achieved a PBAC score of less than 75 at week 12 was with the combination therapy compared to the therapy with agonist. The secondary endpoints, there was a gradual increase in the proportion of patients achieving 50% reduction in PBAC score. The volume of uterine fibroid decreased by 48% at week 12 in the combination therapy. There was reduction in time to achieve amenorrhea, and the percentage PBAC score were observed at weeks 4 and 8. Improvement in the quality of life. So what was the conclusion? This combination therapy achieved PBAC score of less than 75 at week 12, reducing the fibroid volume as well as improving the quality of life and showing a good tolerability compared to the ones who were on GnRH agonist. Now, there are certain special populations where would you use this drug. In pregnancy, it is a no. Lactating women, it's a no. Now, this is not a contraception. So, while these patients are on relugolix, you have to keep in mind that they have to be prescribed contraception, and a non-hormonal contraception is a must. While she is on therapy, even 1 week after she is stopped. Safety and efficacy in children is not established, and it is contraindicated in women with hepatic airway. Now, since this is a special warning, is like any other COC, this also has estrogen and progesterone. So there is a risk of thromboembolic disorders. So if the has any, where you suspect a cerebrovascular event or any traumatic event, you have to stop the drug immediately, or also keep in mind not to use it along with erythromycin. So what was the study conclusion? The fixed dose combination of relugolix with estradiol and non-retistrone acetate treatment is resulted in significant improvement in the quality of life in Indian patients with heavy menstrual bleeding associated with uterine fibroids, and it is well tolerated with preserved bone mineral density. These are the various international guidelines, NICE, ACOG, SOGC, and Australia, where all of them have approved the use of this particular molecule in patients with heavy menstrual bleeding due to uterine fibroid. So what is the summary? We know that uterine fibroid, Dr. Seema has already pointed out, there's a high incidence of fibroid amongst the Indian subcontinent. So existing pharmacological and surgical management options have limitations like ineffectiveness, inconvenience, complications, and need for advanced facilities. Relugolix, the combination therapy is approved in reference countries. This therapy has also been shown to be effective in improving heavy menstrual bleed and other associated symptoms in pivotal studies of innovator. And so what they want to say is that it is not just the global data. Even our own country's studies have been done, and it is found to be efficacious. It is well tolerated with a long-term safety for at least 2 years. Thank you.